Hello everybody, this is Dave King DDS again. I wanted to go over a brief anterior implant case with you. This is a fun case that allowed us to put in an immediate implant at the time of extraction, as well as to restore it with an interim restoration at the same appointment using CEREC technology. So here what we're looking at is an x-ray. This is how the patient, who is in her mid-40s, presented to the office. She was symptomatic. She had that horizontal root fracture in tooth number 9, and it had previously been restored with a crown. I'm assuming that the crown was placed when the tooth was traumatized, which is probably when that fracture happened. So, that being said, she was symptomatic, so we opted to go ahead and treatment plan, kind of discuss with her what options she had. So best choice for her was, of course, a dental implant, but we did discuss bridge options and partial options. She was a very meticulous woman, very well groomed, very concerned about her appearance, and wanted to make sure that she had the best and most aesthetic possible outcome. So appointment number 1, since I placed many implants and we had the implants that we needed on hand, I went ahead and we scanned the tooth using CEREC, the OmniCam, and I think it was software version 4.3. I scanned it for biocopy. I wanted to make sure that we had a good representation of what the tooth looked like currently. Once we scanned it for biocopy, I went ahead and extracted the tooth, placed a Nobel Active implant. I believe that's an 11.5 millimeter implant that we're looking at right here. Once the implant itself was placed, I delivered a tie base with a scan body and scanned the scan body, and then created a restoration. And here's some images of the restoration design process in CEREC. So it was done with the biocopy, as I mentioned, and we designed her a temporary restoration, which was initially screw retained, allowed her to wear that restoration excuse me, for about 3 months when she returned, and we did the final restoration, which you see here. In the end, we ultimately had to re-mill the final cement retained crown after replacing that temporary restoration with hybrid abutment. We had to mill the the permanent crown, the cement retained final restoration, about 5 times to make sure we got the right shade. We had opted for a Vita ceramic. I think I used some Empress Multi or a Vita Trilux. Anyway, it was nice, but it was very challenging to get that shade right. You know, single anterior sometimes creates a challenge. But we did end up letting her walk out the door at that final delivery appointment with a tooth that she was very happy with. She did ultimately have to step outside several times to get a view of what the natural light made the tooth look like. So we made sure that we had a perfect shade for her before she left the office, because like I said, she was very meticulous and very not demanding, so to speak, but she wanted her tooth to be perfect, and that's exactly as it should be. So just a fun case for you to consider. You know, if you're to the point where you're considering doing something like this, you want to make sure, number 1, that you've had a lot of experience doing it already. This is not something I would try to do without a safety net unless you've done it many, many times. Now, as we're getting to that point, we can actually design a surgical guide and have it milled with our CEREC machine using the CEREC guide process. And then you can place that implant exactly where you want it to be if you have a cone beam x-ray that you can incorporate into the CEREC guide and the planning software. So I did not do that on this case. I free-handed it, so to speak. The buccal plate, all of the bone around the tooth was intact. I did have to do a little bit of bone removal to get the apex of that tooth out of there since it had fractured mid-root. But ultimately the bone was intact and she responded very well. Her gingival tissue was beautiful. There was no change in the height of the gingival tissue. We were able to design her a restoration that afforded her a very aesthetic, nice, high-quality outcome. So thanks for watching. We will catch up with you later.